Across the globe, there is an increasing epidemic of lung disease. Its roots lie in breathing polluted air from tobacco and indoor and outdoor pollution, and also relate to infections such as tuberculosis and pneumonia. The damage done to lungs is usually permanent and irreversible, but useful treatments do exist. While drugs may be used, these are expensive and seldom available or affordable in much of the world. And chronic lung disease hits hardest the poorest people, who cannot afford medicines or good food or clean fuels like electricity and gas, so they have poor immunity to infections. Professor Zoranbayev, Chief Pulmonologist of the Ministry of Health of the Kyrgyz Republic, explains the scale and the main causes of lung disease in Kyrgyzstan.
We have a lot of COPD patients and we have many TB patients in Kyrgyz Republic, and unfortunately also we have very high mortality data for COPD patients and also for TB patients. Main causes for COPD, for other chronic respiratory diseases, this is first of all smoking. You know, we have so many people who is smokers, and they are unfortunately they don't understand about importance to stop smoking, and more than half of male in our country they are smokers. This is main cause. Second important risk factors for COPD, chronic respiratory diseases, and for TB, this is indoor air pollution. And also we need to also have some activity for improving this situation. We need to have people who will be not smokers, and we need to protect our people from indoor air pollution.
In Kyrgyzstan, people are exposed to air pollution in their everyday lives. Many people use fires for heat during the long cold winters and for cooking. The cook stoves can produce a lot of smoke in a limited space. Pregnant women and children, as well as older people, are especially vulnerable, not least because they spend many hours indoors. Exposures at work add to the issues. There is an increasing problem of drug-resistant TB in Kyrgyzstan, and even when fully treated, patients have major permanent lung damage.
Unfortunately, we don't have now good results from treatment for COPD patients and for other diseases in our country. We use international guidelines, we use a WHO recommendation, and mainly this is medicine, and also some activities for stop smoking. But for improving management of COPD patients, for improvement results of treatment, we need to use additional approach, and very important to give more attention and to actively involve for treatment process rehabilitation program. And we believe if we will use and if we will integrate rehabilitation program, we can improve management of patients.
Pulmonary rehabilitation is widely used in Western countries, and through the Fresh Air Research Programme, testing of this rehab is taking place in Africa and Asia. The rehab programme involves exercise, training and education to make people fitter and stronger. It also makes them aware of what can damage the lungs and how to avoid further damage, as well as how to manage their disease in the future. In Africa, pulmonary rehab was successful in improving patients' quality of life, strength and fitness. Using only local health workers, it was shown that pulmonary rehab can be delivered at low cost in a sustainable way. Pulmonary rehabilitation pilot projects have also been set up with Professor Zoranbayev in 3 hospitals in Kyrgyzstan. Patients find the programme very acceptable, while medics report that it's relatively easy to set up. Some changes have been made by the staff at the National Rehab Hospital, and now many patients are being treated.
We have now very good experience, and we have now good knowledge about pulmonary rehabilitation program from UK, and this is so nice. We take materials for pulmonary rehabilitation program from UK, and we will do translation into Russian and Kyrgyz language, And we will integrate pulmonary rehabilitation program to our healthcare system to cover whole country and to do available this program for all patients.
This lady, who has COPD, has now completed the programme and explains how she has improved.
Before I started the rehab, I just had to stay close to the bed as I couldn't really do much at all. I could barely talk with my family. I had so much pain and I used to take a lot of medicines. But by doing the rehab program, I feel like I can actually smile again because I'm becoming stronger every day. In fact, just 2 days after starting the rehab exercises, I began to feel better. And I really believe that if I continue to exercise at home, I would be able to do so much more in the future. Before the rehab, I could hardly walk at all. And now I can walk to the market, which is like 1 kilometre away. I have much less pain too. I feel so happy that my health is improving now.
Kyrgyzstan is a mountainous country and a very large population lives in remote rural areas. The team from Plymouth University wanted to explore how they could adapt the programme specifically to the people and cultures of Kyrgyzstan and to discover where would be the best place to deliver the rehab. The team investigated if delivery would be useful in the small towns and villages in the mountains and whether existing clinics and health spas could be used. They also wanted to understand if the rehab could work in TB hospitals, where patients stay for up to 2 years having supervised treatment. Additionally, the team wanted to gain patients' views on what makes the rehab enjoyable and what can further motivate them to keep on with the exercises. Dr. Keir Phillip from Imperial College in London is a chest physician with experience in rehabilitation and an interest in music and dance.
There are a number of different ways in which pulmonary rehabilitation can be individualised and made appropriate for any one context. Mostly, the formal training which we deliver is quite acceptable to patients. But just because that is acceptable, it doesn't mean we need to stop there. We can actually utilise a lot of the strengths that the community and the individuals have to help with engaging them into the pulmonary rehabilitation programme. So one of the things we've been doing here is exploring the potential use of music and dance as adjuncts to pulmonary rehabilitation. Now, the response has been extremely positive. We've gone from meetings in which we're just discussing the technicalities of how pulmonary rehabilitation might be delivered to mentioning dance and everybody lighting up and saying, wow, that would be amazing, this could be great, do you know this dance, do you know that dance, do you know this song, do you know that song? Because I think this is one of the really important things to realise is that here in Kyrgyzstan, music and dance are integral parts of their culture and traditions. These are real positive attributes, things that we can utilise to engage people in pulmonary rehabilitation and other forms of physical activity in chronic lung disease. Really get buy-in, but not for just the purpose of increasing our numbers, because this is actually just really important to do. Why not make it more enjoyable?
As part of their research, the team held meetings with the health workers in a clinic in the small town of Atbashi in a mountainous region, and also in a tiny village clinic in Toldi Sun. Here they found there was general enthusiasm to develop the programme. The health workers felt it would be both helpful for the patients and easy for them to deliver. The doctor in Toldi Sun told the team that her patients in mountainous areas often become isolated and lonely in the winter. Currently, many older patients and those with chronic lung disease spend long winters in small rooms and seldom go out, so they become unfit and even more breathless. The thought of being able to come to an exercise and education programme would be attractive, especially if it involved music and dance. The team also visited the sanatorium on the shores of Lake Issyk-Kul, which was built by the Russians in the 1960s, and where patients undergo a range of therapies. In meeting with patients and staff, the team discussed how the rehab could be developed here. The patients were very keen to see the programme established, particularly if the formal exercise and education could be followed by music and dance.
What we've found through discussing music and dance with these patients is that it changes the tone slightly of the programme. So it stops being a formal thing in which the patients receive a formal programme, and it becomes much more of a collaborative project in which the patients themselves and the staff have really valuable contributions that they can make towards their own rehabilitation. And that's something really quite special.
Across Kyrgyzstan, patients repeated the same message, that they wanted to have pulmonary rehab widely available and that music and dance should be included at least at the end of normal treatment sessions. On returning to the capital Bishkek, the team visited the city TB hospital and heard how many patients feel low and down about being away from their friends and family, having many months of drug treatment. The staff confirmed that it was entirely possible to set up the rehab programme in the hospital and felt the patients would really benefit. Some patients become so miserable that they refuse to take their treatments. However, when the rehab programme was explained, the patients were very keen for this to happen. With new funding, new rehab projects can be set up for patients with TB. Kyrgyzstan is a beautiful country with wonderful and friendly people. Sadly, many individuals with badly damaged lungs have miserable lives. However, the pilot studies have shown that rehab can help them. Now, with support from the Ministry of Health, the team are aiming to spread the rehab across the country.
We have very great and a lot of plans for pulmonary rehabilitation program in future. We can involve for this program our TB patients, MDR TB patients, and also other respiratory patients. We believe our patients, they will have very good quality of life. They will have long life with rehabilitation program.